If you're exercising to improve your bone density, but your results aren't changing or are changing very slowly, there are usually a few specific reasons for that. In this video, I'll walk you through the most common ones and what you can do instead. Many people exercise but see little to no improvement in their bone density. Very frustrating, and there are a few different reasons for that. In no particular order. Reason number one is that they are doing the wrong type of exercise. They might be doing cardio, they might be doing yoga, they might be doing fitness classes, all of which are good in their own right, but not specifically for your bones. Cardio is great for your heart, but it doesn't strengthen your bones. Yoga is great for your flexibility, but it doesn't strengthen your bones. Same thing for fitness classes. So you have to choose the right tool for the job. Because if you choose the wrong tool, even if you work at it really, really hard, it's not going to get the job done. Reason number two is that very often, even if people are doing strength training, they're not using sufficient load. The weights are too light for their abilities. And reason number three is the complete lack of progressive overload. In other words, if you have osteoporosis and you lift the same light weights forever, technically you're kind of doing strength training, but it's not progressive strength training. If you have osteoporosis and you do that, you'll still have osteoporosis. You'll maintain your bone mass at best. However, if you have osteoporosis and you use progressively heavier weights over time as your body gets stronger, you'll have stronger bones. In some cases, a reversal of osteoporosis, in other cases, just an improvement, but in either case, you'll have higher T-scores and a better bone density. Reason number four is simply incorrect exercise selection. People often think that because they're exercising, it's going to have a global effect on their entire body, but that's not how exercise works for bone density. There is a law in physiology called Wolff's law. Wolff's law states that bones only get stronger at the very spot that muscles pull on them. So on your screen right now, you see the picture of the butt muscle, the glute, and it attaches to a very specific part of the thigh bone or the femur. Only that part that it attaches to gets stronger. Here's another picture of one of the quadriceps muscles, that's the front of the thighs, attaching to a different part of the femur, the thigh bone. That specific spot will get stronger, whereas the remainder of the femur will not, unless you have other muscles that attach to other parts of the femur. So what should you do instead? Of course, you have to use strength training with progressive overload at the adequate dosage. So what do I mean by that? Well, think about it this way. For a medication to work, think of exercise as medicine. For a medication to work, it needs to be A, the right medication, and B, it needs to be at the right dosage. The same thing is true for exercise. It needs to be the right exercise. In other words, it needs to be strength training, but even within strength training, you have to use the correct exercises. Second of all, you have to use the right dosage of strength training. When it comes to strength training, dosage refers to things like the amount of weight you use, the number of repetitions, the number of sets, the number of days per week. This is what comprises the exercise prescription for strength training. And lastly, mistake number four is using the incorrect exercise selection. So things like cardio, great for your heart, but doesn't do anything for your bones. Things like strength training does something for your bones if you use the right exercise prescription. If you do strength training with the wrong exercise prescription, it won't get the job done. My name is Igor. I help adults over 50 improve bone density naturally and without medications. If you want to dive much deeper into this, I created a special video called the Stronger Bones Checklist, 6 steps to improve bone density naturally. This video is not available on YouTube. However, it is available to you for free if you visit this link on your screen right now or in the description below.